Hi, Todd Ramsey here. Today I want to speak with you about some of the more frequently asked questions that we receive. First, we have Eric from Redmond. He wants to know, is it possible to use a ResMed mask with a Respironics CPAP machine? Well, yes it is. The outlet sizes and the tubing connectors are all standard sizes, so no matter which brand of mask you use, it will fit with any brand of machine. Now, the only exception to this will be the heated tubing circuits. Each brand has its own proprietary connection, so you need to use the same brand of heated tube as the brand of the CPAP machine. Our next question today is from Arnie from St. Louis. And Arnie wants to know, why can't I adjust my own CPAP pressure to help me feel more comfortable? Well, let's review here what we're doing with the CPAP therapy. The purpose of the CPAP therapy is to create an internal neumatic stint that keeps the floppy tissue of the upper airway open while you breathe both in and out. If you turn the CPAP pressure down, then you will not have enough pressure to keep that upper airway open, and you'll start obstructing and snoring again. Additionally, if you turn the pressure up too high, then you can actually cause a problem that we call central sleep apnea. So, no, you don't want to do that. Keep your CPAP pressure where the clinicians have set it. And now we have a question here from Jeff from Seattle. And Jeff wants to know, how frequently should I clean my CPAP mask? Well, your CPAP mask and tubing and humidifier chamber, for that matter, should all be cleaned daily. No matter what style of mask, the mask is going to be in contact with your skin, and our skin creates natural oils. Well, these oils can actually accelerate the deterioration of the mask material. So it's very desirable, both from a hygiene perspective and from a budgetary perspective, to keep your mask and equipment clean so that it will last longer and work better for you. Now we have a question from Alice in Biloxi. Alice wants to know, how frequently should I replace my CPAP mask? Well, Alice, there's many variables in how frequently you should replace your CPAP equipment. And some of those variables must include, how frequently do you use the equipment? Do you use it for 2 hours a night? Do you use it for 10 hours a night? Do you have extra oily skin? Are you cleaning it on a regular basis? All of those factors will affect how frequently the equipment will deteriorate and break down to the point that you need to replace it. Well, the only published guidelines are the Medicare guidelines. And they say that a nasal cushion and a nasal pillow can be changed twice per month. The full face cushions need to be changed, or can be changed, once per month. The mask frames can be changed every 3 months. The headgear and chin straps can be changed every 6 months. The CPAP tubing can be changed every 3 months, whether it's heated or standard. And then the washable CPAP filters can be replaced every 6 months, while the paper filters can be replaced twice a month. Alice, I hope that helped answer your question. And now we have a question from Kevin from Des Moines. He wants to know, why do I have to use distilled water in my humidifier? Well, Kevin, regular tap water contains minerals and microorganisms. And of course, the microorganisms can occasionally be detrimental to your health if you're breathing them in. The minerals also can cause a buildup in your humidifier chamber, which can be very difficult to clean out and cause you to need to replace your humidifier chamber sooner than you should need to. And now we have a question from Becky from Santa Fe. And Becky wants to know if she has to use her CPAP for the whole night to receive a benefit from it. Well, Becky, it's very desirable that you use your CPAP for the whole night that you're asleep, for the whole time that you're asleep. It's very desirable for that to happen. But at the same time, since you are getting a benefit while you're using the CPAP therapy, then a little bit of use is better than none at all. In fact, many clinicians will advocate that you start your CPAP therapy with a very short period of time of use for the first couple days, and then gradually increase that time until you are eventually using the CPAP throughout the whole time that you're asleep. But you do want to use it for as much as possible, and also it is known that both Medicare and most insurance companies will require that you continue to use your CPAP for a minimum of 4 hours a night before they will pay for the therapy. So Becky, I hope that helped you understand how important it is to use your CPAP therapy for as long as you can every time you sleep. Well, it looks like that's all we have for today, but if you find you still have a CPAP question, let us know. You can find us on Facebook, Twitter, or you can send us an email at sales@restshot.com. This is Todd Ramsey. Thanks for joining us today.